Okay, this is Dr. Mcdougall on heart disease, part 1. It's from the book John McDougall, The Doctor Who Fought for You, written by me, Pete Rogers. Okay, so he starts out talking about Dr. Kempner. Kempner had shown that plant-based diets reverse coronary artery disease by EKG in the 1940s. Nathan Pritikin had shown it starting in the 1960s. Blankenthorne had showed it by cardiac cath in the 1970s. Dr. Ornish had shown it in the 1990s. Dr. McDougall had seen that with some of his patients. So basically, and then Esselstyn subsequently has shown that as well, the ability to partially reverse coronary artery disease with plant-based diets has been known for a long time. And low-fat plant-based diets are the only ones that have been shown to reverse coronary artery disease. There is no other diet. You should know that. That's important to know. And then McDougall gives some references here, which I find rather amusing. 4 out of 4 studies show that there are more deaths in the patients eating low-carb diets, because there's a lot of nonsense on the internet. Basically, you know, the food business is a multi-billion-dollar business, so it's important for them to keep the pros confused, so they'll continue to eat the high-fat foods, the junk food, the meat, the oils. Okay, so here's the first study, and Dr. McDougall is great about this, getting references for all these studies. Okay, the animal low-carb carbohydrate score was associated with higher all-cause mortality. More of the patients eating low-carb diet. So basically, when they say low-carb, what they're saying is eat more animals, okay? Because if you're not going to eat carbohydrates primarily come from plants. There's no carbohydrates in animal foods other than lactose and milk. What they're trying to do is get you to eat more animals, but they don't want to say eat more animals, so they call it low-carb. Okay, number 2. Low-carbohydrate, high-protein diets used on a regular basis are associated with increased risk of cardiovascular disease. In other words, the patients who eat more of a low-carb diet, they die sooner. They die more often. Okay. Study number 3. Low-carb diets are associated with significantly higher all-cause mortality. Dr. McDougall says, do you get it? Low-carb diets kill people. And the benefit of having these studies is, because you'll hear a lot of hot-headed, the sort of vulgar, ignorant, loud, typically paleo, keto, carnivore, low-carb crowds. And you just say, here's the 4 studies, and these were the only ones Dr. McDougall said were available at the time he made this. This was 2014. There's another one coming up too, I think, number 5. Okay, so study number 4, greater adherence to low-carb diets, high in animal sources of fat and protein are associated with a higher all-cause mortality. The people who eat the low-carb diets, they die sooner, okay? Okay, number 5, low-carbohydrate diets, low-fat diets, low-carbohydrate diets versus low-fat diets and mortality in middle-aged and older people. The low-fat diet lowered mortality by 18%. Okay, actually, Dr. Mercola himself, according to Dr. McDougall, gave up on low-carb diets after this study. It was just too much. The data is overwhelming. And then other ways that the data is overwhelming is just look at the epidemiology, okay? Look at Dennis Burkitt when he's in Africa. He never saw colon cancer, gallstones, diverticulitis, any of these abdominal pressure syndrome diseases in the populations eating the plant-based diets in Kenya. They didn't have rheumatoid arthritis reported before 1957 in Africa because they were eating plant-based diets. In 1929, the Lancet paper by Donison, 1,800 consecutive admissions, blacks eating plant-based diets, 0 hypertension. In the USA, there'd be like 90% of them are hypertensive. Tarahumara eating a corn plant-based diet, organic corn. They got low cholesterol. They can run 100 miles in 2 days. You go to China before 1970 when they ate 90% of their calories from white rice, 1% of calories from fat. They're all skinny, 1 billion out of 1 billion. What I'm trying to say is you start going through the epidemiology, it's overwhelming. The Pima, same genetics as the Tarahumara. They eat the SAD diet. They're all fat and sick. You look at the Yanomamo, same blood pressure when they're teenagers as when they're in their 70s, eating a plant-based diet. It's always like that. There's no comparison. So what they have to do is puff up their chest and talk a lot of phony nonsense because they really have nothing to support their diet, the paleo, keto, carnivore, low carb. A person can do briefly well on any type of diet just because they're watching everything they do so intensely or they're being surveyed by researchers. That's called the Hawthorne effect. So you get an artificially increased beneficial results in the short term with any type of change in behavior because it's done so meticulously. But it's not sustainable. The patients are constipated, they smell, they got increased kidney stones, the ketosis doesn't feel good. It causes all kinds of problems, bad breath, etc., and poor health, and it leads to plugging up the arteries. So anyways, we're going to leave it there for this first round of heart disease by Dr. McDougall.